Psoriasis affects at least half of those who have it. Plaques form when the skin cells on your scalp grow too quickly and form powdery or thick scales. The skin around them may become red and irritated. Scalp psoriasis can range from modest scaling to crusting across the entire scalp, extending occasionally to the forehead, around the nose, in the beard area, and behind or inside the ears. If your scaling is minor, it may improve on its own. However, you may require medical attention at times. More severe dandruff can take a few months or more to get under control. You might be able to avoid it from flaring with specific shampoos or moisturizers once you've found it. Psoriasis has no known cure. Your treatment will be determined by the following factors. What is the severity of it? How it has previously responded to treatment. Whether or not you have psoriasis on other parts of your body. What kind of hair do you have? Where to begin treatment? For mild cases, the most common treatments are medicines applied directly to the scalp. You may require a treatment that addresses your entire body if you have a more severe disease or psoriasis elsewhere on your body. These drugs can be used orally or intravenously. Your doctor may replace or combine one form of treatment with another if your psoriasis does not react effectively after frequent usage of one. Softening and removing scales is one of the initial steps. This makes administering drugs easier. To soften scales and make them easier to peel off, apply over-the-counter, OTC, treatments to your scalp. Look for products that contain salicylic acid, lactic acid, urea, zinc pyrithione, or selenium sulfide as active components. With a brush or fine-toothed comb, gently release the scales. Use a salicylic acid shampoo or soap to eliminate the scales from your scalp. To keep the moisture in your scalp, apply heavy creams when it's still damp. To use medication, follow these steps. To keep the drugs for your scalp out of your ears, apply petroleum jelly to cotton balls and insert them into your ears. If you have psoriasis in your ear canals, avoid using cotton balls. Use drugs only when absolutely necessary. They can irritate the skin and weaken hair shafts, resulting in temporary hair loss. Part your hair and apply the drug to your scalp with an oil or moisturizer. Apply a cream or ointment to your scalp and massage it in. Some medications may function better if you cover your head with a shower cap for a brief amount of time, but see your doctor first. Treatments that are gentle. These may be suggested by your doctor. Shampoos, lotions, gels, ointments, foams, and soaps containing coal tar are available over the counter. They can help reduce inflammation, itching, and scaling while also slowing skin growth. Massage a coal tar shampoo into your scalp and leave it on for 5 to 10 minutes before rinsing. Other tar compounds can be left on overnight. The biggest disadvantages are staining and odor. After shampooing, use a non-medicated conditioner to combat the tar shampoo odor. Salicylic acid, a peeling agent, is included in both over-the-counter and prescription shampoos and soaps. It has the ability to soften scales and make them easier to remove. Coal tar and non-coal tar medicated shampoos are both available. You can use these on a daily basis to treat scalp plaques as long as you follow the guidelines. Inflammation can be reduced with intralesional steroid injections. A doctor injects medicine into scalp plaques with a tiny needle. This operation can be done in the doctor's office. To relieve itching, try the following. After shampooing, use a conditioner. Hairstyling with hot tools should be limited. On itchy skin, use damp towels, cold packs, or cold water. Tar shampoos, as well as those containing menthol or phenol creams, are available over the counter. You can also talk to your doctor about taking over-the-counter antihistamines. Treatments for moderate to severe psoriasis. To treat moderate to severe scalp psoriasis, your doctor may prescribe steroids, lotions, solutions, sprays, or foams. Some topical therapies are applied to the skin directly, then shampooed and rinsed away, such as anthralin is a type of anthralin that is Psoriatek. Once a day, for 10 to 30 minutes, apply this cream. Calcipotriene is a kind of calcipotriene that Dovanex. This is a prescription-only vitamin D supplement. Apply it to your scalp at night and cover it with a shower cap. Turn it on for the night. Keep it out of your eyes. Betamethasone dipropionate with calcipotriene, Taclonex scalp, Enstellar foam. This is a mix of a vitamin D type and a mineral. Tazarotene is a kind of tazarotene that Tazorac. This vitamin A therapy is available as a cream, foam, or gel. If you're using it at night, apply it to clean, dry skin and wait for it to dry before going to bed. After taking the prescription, use a moisturizer to keep your skin from drying out. For all drugs, follow your doctor's instructions. Without your doctor's permission, don't use harsher steroids for more than a 2-week cycle. Another therapeutic option is ultraviolet UV light. Hair can obstruct light from reaching your scalp, but parting it in rows may help if you have thick hair. UV combs are handheld devices that transmit light directly to your scalp. What to do if you have an infection? Crusting, redness, warmth, pain, and even enlargement of your lymph nodes may occur if your scalp psoriasis becomes infected. This problem may necessitate the use of antibiotics, which your doctor may prescribe.